Well, Omicron and Delta may strike people at the same time and combine to create an even worse COVID variant in the coming weeks. Moderna vaccine maker's chief medical officer, Dr. Paul Burton, has warned. He says this new super variant could be created if Omicron and Delta infect someone at the same time. COVID infections are said to normally only involve one mutant strain, but in extremely rare cases, two can strike at the same time. Well, joining us to talk to more about this is Dr. Ganiu Jamiu, who is a public health physician. Thank you for joining us on the program.
Thank you very much. Good evening.
All right, Doctor, do you agree with the Moderna chief, the Delta and Omicron combining to form yet another variant?
Well, there's nothing possible in medicine, and looking at the evolution of the virus itself, it's possible that it's not impossible because, as we all know, the virus keeps on mutating. We started with Alpha, we got to Delta, currently we are talking of Omicron, so it's likely, there's nothing impossible in medicine, it's possible it can actually happen, and following that anything can still happen. Yeah, I agree with you.
But also, you know, people are wondering if this has ever happened before in terms of the combination of viruses. I mean, some experts have said that the Alpha variant seems to be a recombination of the B.1.5 and another virus together, but then after a number of days, it disappeared.
Well, as I've said, there is not, you can't actually predict. One thing we need to understand is that what is happening as regards to variant of concern is that it is an adaptive process among microorganisms, even the bacteria. So what they do is that what the virus is trying to do is to continue to survive, and that is why the virus is devising every method to see that it defies every measures, especially with the use of vaccines and so on, to make sure that it keeps a kind of multiplying and keep on, causing infections among the susceptible individuals. Yeah.
So, with all of this happening, what are the chances of this happening in Nigeria? Some people have said that, should we in Africa handle the COVID-19 differently from our Western brothers? And this is based on what we see of the epidemiology on our part.
Well, I just want to clear something before I respond to your question. Preliminary studies have not really shown that the Omicron variant it can cause more infection. That is, it has tendency to cause higher more infections from one person to the other. And it has also not been shown that it can cause severity of infection. There are still a lot of studies still going on. The only thing that is available based on recent finding is the fact that giving a third dose, a booster dose, we ensure that there is a kind of protection of vaccine against the virus. So all these speculations, there has not been any data to actually verify whether the ongoing transmission or increased number of cases globally is as a result of Omicron. No, it has not been actually established. So for us to start speculating and saying that this is what the virus is causing, whatever, I don't think there has been any evidence as regards to that. There is still a lot more need to be learned about it. And by the way, globally now, we barely have only a total number of about 10,000 number of Omicron cases globally, with about roughly 2,000 plus in Europe, and the rest of other countries having about 7,000. So there is still a lot that needs to be known about the virus. But the key thing that we say is that our approach will not vary from what we used to know. The only thing is that we should not lose our guard. And based on available evidence, we need to keep on with surveillance. That is our enhanced surveillance. And apart from that, again, we need to also step up our genomic surveillance, that is sequencing, ensuring that those data are feed into the WHO database so that can inform decisions. But and one other thing I just want to say again is that please, irrespective of where vaccination is very important to a kind of protecting against the virus, we still need to maintain the non-pharmaceutical measure, which is very, very key. Because for now, the vaccine can only protect against severity of infection and likelihood of hospitalization. But issue of transmission from one person to the other, I don't think it can be achieved at now, because for us to get to that level, we must have achieved a global herd immunity of at least 70% of the world being immunized. So that's just the point I want to mention. Thank you.
But also, that is also questionable in the wake of the Omicron variant and what we're learning from it. But we always appreciate your time on the program. Thank you. Dr. Ganiyu Jamiu is a public health physician. Thank you for joining us.